Hey, welcome. It's the Happy Doctor. And June has been a month for men's mental health. So in this video, I'm going to be talking to you about the subject of mental health. I will not necessarily focus on men because mental health affects everybody. It affects children, it affects adolescents, young adults, men, women, and the elderly. So I just want to speak about mental health generally. So what is mental health? When we talk about mental health, what do we mean? It's the general well-being of someone's mind. Simply put, that is mental health. The general well-being of someone's mind. How someone relates to life on a day-to-day basis, how they react to situations, how they face challenges on a day-to-day in their lives. That is mental health. And what is the size of the problem of mental health challenges? So globally, according to the World Health Organization, 14% of the world population actually live with a mental health disorder. Now that is a big population. But also coming down, 1 in 8 people will have a mental health disorder. Yes, I know that's quite big, but the problem is even bigger in developing countries, what we call the low and middle income countries, where 75 to 85% of people with mental health disorders live with them and they are not receiving treatment. So mental health disorders are real. Like I've told you, they affect different populations, but adolescents and young adults are commonly affected. They are the most affected. And of course, the reasons are very obvious. They are going through a series of changes in their bodies, in their minds, their psychology. And for the young adults, responsibility is knocking at the door. So they have not got the skill to cope, to juggle the new responsibilities of new work, new families. Some of them are starting families, changes in environments. So you find that mental health is very common in that category of people. So I now want to talk to you about the risk factors. What will put someone at risk of developing mental health? Of course, most of us know that stressful conditions increase one's risk of developing a mental health disorder. Yes, some people lose jobs. When someone loses a job, they are financially unstable, not sure of tomorrow, how to take care of their family. It can predispose them to a mental health disorder. Losing a loved one can also significantly predispose someone to a mental health disorder if they are not supported or they do not know how to deal with a grieving process. So stress, very, very critical factor to predispose to mental health disorders. Number 2, some people get trauma when they get accidents and they have injury to the brain. Sometimes the trauma is from infections. So whether it was an accident and the brain was involved or it was an infection, with the healing process, just like any other wound on the surface of your skin, that kind of trauma, either from an accident or an infection, leaves a scar on the brain. And so if it is to a large extent, it will predispose somebody to mental health disorders. Then the other one is, of course, consumption of drugs and substances. Alcohol intake that is unregulated, use of drugs of abuse, other drugs of abuse like cocaine, like marijuana, different drugs that some are even sold on the streets. You find that with time, as people use them, they tend to develop mental health disorders. Yes, I want to also emphasize the issue of upbringing of children. Children who grow up in unstable homes, in environments where they are either abused or have abusive parents, are predisposed to developing mental health disorders. It is a very significant risk factor. The other risk factor, finally, is for mothers who carry babies and they are pregnant and do not get all the recommended treatment, the recommended care during pregnancy. That care that you receive in the hospital is meant to aid your baby to develop normally so that you reduce the risk of mental health. Now, I want to go on to talk to us about the symptoms. How do we tell? How do we suspect that somebody actually has or may be developing a mental health disorder? Please, I want you to know that mental health disorders are not just limited to what we see manifested. A lot of times, by the time someone manifests a disorder that we commonly refer to as madness, they have long developed the disorder. They have expressed some of the symptoms I'm talking to you about today, and we did not recognize them. So what are some of these symptoms? Some of these symptoms include extreme worry. You notice someone is extremely worried or you worry a lot. Fear. People have extreme episodes of fear. They fear little things. They fear death. Something moves. They fear. They are afraid of literally everything. And so you find they will even keep away from certain activities because of fear. Then restlessness. Some of the people, because of anxiety, they become restless. They cannot concentrate on something. Then extreme sadness. A lot of times, we may think, oh, maybe somebody is an introvert, maybe they're experiencing a change. Watch out if someone has one of the risk factors I mentioned and they begin to manifest some of these symptoms. Some people may actually fail to concentrate on their work. They fail to complete tasks. Tasks that they used to do before and finish them within a particular time period, they start to fail to complete their tasks. Withdrawal from social circles. Watch out for that friend who withdraws from the social circles, stops attending the parties, stops coming to church, stops calling or chatting on a group. You're in a WhatsApp group and suddenly one of you stops chatting. When you notice that, please ensure to follow up that colleague. Then changes in behavior. Some people exhibit mental health disorders as change in behavior. This could be as subtle, like I've said, as subtle as withdrawal. Some people could go to the extent of engaging in risky behaviors. Examples like alcohol consumption. If they were an alcohol consumer, they may exacerbate the consumption. If they were not a consumer of alcohol, they may actually begin to consume alcohol. Some people will exhibit forgetfulness. Someone who used to do everything in a timely manner knows where they place something. Watch out. If you or your loved one, someone in your circles, begins to forget, they forget appointments, they forget where they placed something, mental health disorders could be the underlying problem. Then, of course, at the extremes are hallucinations. Hallucinations is when someone begins to hear voices speaking to them, voices instructing them to engage in activities that you may find are not regular things that they should be doing. So you're asking yourself, happy doctor, what can I do to help? I want to let you know that everybody in the community has a role to play in regard to preventing mental health or if it has happened, mental health disorders, or if they have happened, we have a role to play in supporting the people that could be experiencing these disorders. Number one, what are some of the things you can do? Understand the person. Understand the people and what they are going through. Recognize that there is a problem. When you recognize the problem, understand that it is a problem. One of the things I need to tell you that when you are taking that trend, you actually will recognize a change in how you're doing things. So when you recognize it, seek help. Seek help from colleagues, from close family members. Seek help from someone you trust. Yes? Talk to a counselor. Reach out to somebody and open up. A lot of times we are overwhelmed. People are overwhelmed with different situations like I've mentioned. A loved one that is chronically ill and has caused the illness has caused a lot of strain on the family. Speak to somebody. If your pocket is empty, speak to somebody. If you're battling loss of a loved one, speak to somebody. Join a social group. Get accountable. Let people ask you. Ask people in your group. We've not seen you come to church in a long time. We've not seen you come for this gathering in a long time. What is happening in your space? We all have a role to play in supporting our colleagues, in supporting our neighbors, colleagues at work. In your family, you have a role to play. Then if someone is on treatment, help them to comply to treatment. Remind them, have you taken your medicines today? How are you feeling today? That is how you can help. And if there is need for you to carry that person to a healthcare provider, reach the nearest healthcare provider. Or you can drop in the comments of this video, I need help, and we'll be sure to reach out and help you. So how do we prevent mental health disorders? Happy doctor, how do I prevent mental health disorders? I already think I am developing a mental health disorder, or my loved one is developing mental health disorder. Number one is to do what I am doing now. Create awareness. A lot of times the community shies away from talking about mental health disorders. Let's create awareness. Speak to a colleague. Share this video with somebody and tell them, could we be having a case of mental health disorder with our colleague? Reach out to a colleague. Remember, it happens. It can happen to anybody, but it can be managed. How else can you prevent it? Ensuring that children grow up in stable homes. Parents, we have a role to play to provide children stable environments to grow. Environments where they are protected from abuse. Abuse by people that visit our homes. Abuse from drugs, from substances, from the internet. We have a role to play as parents to protect our children. Cut down on those harmful habits. If you drink, cut down alcohol consumption. Totally stop it. Yes, you can enroll for a rehabilitation program and totally stop the alcohol consumption, the substance abuse of cocaine, marijuana, and the rest of them. And that will help your health. If you recognize the symptoms, early symptoms, then seek help early. Reach out to a healthcare provider. Confide in them. Ask them what you can do to prevent progression. Help a loved one to access care as soon as it is possible. Access counseling services. Some of the services are online. And if you need counseling services and you say, happy doctor, I need support, I need counseling services, drop in the chat, drop in the comment section, I need counseling, and we shall be sure to reach out and support you. Now, back to the parents. Immunize children. Ensure that you stick to the whole immunization schedule. Why should you do that? To make sure that your children are protected from the killer diseases that can eventually affect the brain and cause mental health disorders. And for the pregnant mothers, make sure you attend your 8 antenatal care visits. And when you attend them, take all the treatment that you are given to ensure that your baby grows normally and is not at risk of developing mental health disorders. So remember that mental health disorders can be diagnosed and treated. So the diagnosis and treatment of mental health disorders will be made by your healthcare provider. How they will make it is they will speak to you and take what we call history. They will listen to your story and they'll be able to make what we call a diagnosis and prescribe appropriate treatment. I now want to talk to you about the myths and misconceptions about mental health in the community. A lot of people have perceptions that are not true about mental health. One is that mental health is not curable. It is treatable. It is curable. Mental health disorders are treatable and they are curable. Number 3 is that mental health disorders are always bewitchment. Not every mental health disorder is from bewitchment. Yes, it can be from bewitchment, but it is not all from bewitchment. If you're stressed from the loss of a job, loss of a loved one, please seek help. Seek help. Do not begin to blame something that may not be the cause of your problem. A lot of people in the community believe that mental health disorders are a curse. Maybe a curse upon a family, a curse upon an individual. Not always. It may happen. I believe that may happen. I don't deny it. But it's not always the case. Trace the root of that disorder and deal with it. The other myth that people have is that people with mental health disorders are dangerous to live around, which is not true. When they are supported and treated with the right treatment, they recover, they are calm, and they can be lived with. So let us not neglect the people with mental health disorders like depression, like anxiety, schizophrenia, yes, which are the end-line manifestation of the subtle symptoms that I have shared with you in this video. This is the Happy Doctor, and if you need any mental health support, drop in the comments, I need help. Take this video, share it with a friend, share it with a family member. You could be the help that they need. See you in the next video.